Hi guys, back for session 4. I hope you had time to take care of look at the other sessions like 1, 2, and 3, and you've managed to learn something from it. Today we'd like to go into a little, not too much, about chest pain, the assessment, documentation, and intervention. Nurses, are you heart smart? By that I mean, would you really know what to do if your patient was having chest pain? For more in-depth information, you can go to dearnurses.com and click on Master Your Clinical Skills Chest Pain Series. Now, here we are. What would you do if your patient was having chest pain? Now, here is Sally. She's on her break. Her friend is asking her, Sally, how is your day going? And what does Sally have to say about her break? That her patient was having chest pain and that she told him to stay calm until she got back. Does that really make sense to you? Well, let's take a look at why this would not be the right response. What causes chest pain, first of all, is the fact that the heart is not getting enough oxygen. The heart is essentially a pump, and it also has what is called an electrical conduction system. The heart has 4 chambers, 1, 2, 3, 4. In the right atrium is what they call the sinoatrial node, and this node pretty much works like when the light bulb is turned on. It fires, and that causes both atria to contract. Then the impulse goes along to the ventricle through what is called the atrioventricular node. When this impulse fires, then both ventricles contract. Each one has a separate job to do. One pumps blood. The right one receives blood from all around the heart. Then it's pumped into this one, the right ventricle. It goes into the lungs, which you cannot see here. Then it comes back through the left atrium, into the left ventricle, and then pumped all over the body. This guy is shoveling snow. You do not take on activities like that if you're not really sure what your heart can stand, especially if you have any degree of heart damage. So someone like this will ultimately wind up with chest pain and shortness of breath, possibly winding up in the emergency room. Now let's take a look at what happened to that patient that Sally neglected to take care of, who was having chest pain. This patient wound up in a rhythm called ventricular fibrillation. Now you may not be able to read an EKG, but that does not mean that you cannot pay attention to what happens. Most patients in cardiac arrest wind up in this rhythm, ventricular fibrillation. It is what is called a coarse, wavy line. Now let's just back up a little bit so I can explain more. Let's go back. What happens when that SA node fires, what we get is when the atria contracts, the SA node fires, we have what is called a P wave. And then the ventricle contracts because the AV node fires, we have what is called a QRS. And then there's a short resting time for the heart and the T wave, and the cycle starts all over again. Well, let's go back to where Sally's patient. Sally's patient is now in the intensive care. I know they brought him out of ventricular fibrillation, but that had to be done with a method called defibrillation, which is done with that. You put on those paddles and then they shock the patients. It must have been quite an ordeal because usually you have to call a code blue. Now, if this patient was having a normal rhythm, he would have what is a P, a QRS, and a T, which would mean atria fires, SA node fires, the atria contracts, QRS, AV node fires, ventricle contracts, and then you have a resting time. But we're not seeing that here. Ultimately, this patient would wind up in ICU because there is nothing going on. There is no movement of blood through the heart, and there is no movement of blood to the tissues or oxygen. So this patient wound up with what is called an endotracheal tube to help him breathe, on a ventilator to assist his breathing also, and he did get his rhythm back here. To learn more about EKG reading, I suggest you go on to EKG series, What is Wrong with This EKG, at dearnurses.com. Now, assessment of chest pain. Chest pain should never be ignored. If your patient is having chest pain, then you need to assess, find out what does it feel like. Some patients will describe it as heavy pressure in the chest. Some may describe it as a squeezing feeling like an extra pair of hands around the chest. Some may describe it as a stabbing or even as burning in the area of the diaphragm, which is close to where the heart lies on the diaphragm. Bear in mind, no one can safely predict when a patient is going to have chest pain. But one thing you can do is to assess, document, and intervene. You call the doctor, you get help. There are many ways you can intervene. Now, you assess your pain on a scale of 1 to 10, 0 being the lowest and 10 being the highest. Of course, if your patient is having chest pain, you've asked him to describe what it feels like. You also would document it. There are certain things you can do. Different institutions have different protocols in place. Some of American Heart's guidelines are oxygen, nitroglycerin, sublingual either or spray, aspirin, and morphine. Now, some institutions, depending on where you work, may have it all written down. The doctor's already ordered it. So patients with chest pain, especially if it's in a unit, like a cardiac unit, you can go to work to take care of it immediately. So check to find out your doctor's orders, what your institution allows, so you can advance to the next treatment. But one thing is clear, chest pain should never be ignored. Now, if you have a patient who's on oxygen, you need to be aware that oxygen is explosive. You advise him not to smoke while the oxygen is running. And one way you can make sure that this does not happen, advise patients not to smoke if they have oxygen running. And do not say that a patient should know or smoking is not allowed. Sometimes patients do break rules, and family members may pop them in the occasional cigarette, especially if they've been smoking for a long time. So I hope you've learned something from this. You might just want to go to EKG series, what is wrong with this EKG, and learn a little more about EKG reading if you want to know. Or you might just try chest pain series to find out more about what causes chest pain. So until next time, stay posted for more clinical issues. Have a great week. Bye.